Good morning. Good morning, gentlemen. This is Engineer Suraj Singh regarding Bharat, India, and analytical talk on COVID-19 status 12th December 20, 2020, reported on 13th December 12, 2020. That's today. Excel file screen share. There's still no signals. Where I'm continuing. Good morning, everybody. Title is Bharat, India, and analytical talk of COVID-19 status 12th December 20. Reported on 13th December 2020, that's today, is regarding yesterday's 12th December 2020, status of COVID-19 in our country. As usual, I submit to you people, I present to you people this file generally every day. I've been doing this for last couple of weeks. I think you may be getting benefit of this if you wish, if you have desire to just to understand what's the status of that in our country. Well, there's no change. It's very explicit, very clear. There has been no change if you compare it to yesterday's presentation and also many presentations in past. It can be said clearly that same figure generally stand, but because it's a statistical issue, logistical issue, to keep a track on something, you have to move on that from time to time and continuously. If you require that and move that continuously, you can understand what's the status from time to time. And that's the reason that I'm giving you analytical, informative talk, not exactly this elaborated talk. This talk is very, you can say, precise and not very explanatory. So I'll just give you background of this, means what's this actually. This file, you know very well. Still we have 11-24 days to go, if so desired by people or by government, and we can say there are 15 crore 37 lakhs 11,833 individuals that have been tested so far, and that is about 11.824% of population of this country, that is 130 crores considered. It could be less, it could be more, but we have just fixed 130 crores. And if you use that formula for we use 130 crores with this already tested people, it comes out to 11.824%, which means 88.176% people have not been tested, and which population amounts to a figure 114.6288177167 crores, which is quite big, you can say. A ratio of 1188 still stands, 1:8. It hasn't gone. Still it is there, though it's 200, you can say, 88 days today. If you count from March of this year, this is 288 days, and we have just been able to test only 15.37 crore people, which is 11.824%, while 88.176% people still stand untested. This means 1 out of 8, or you can say 1 out of 9, has been tested, while 8 have not been tested. Reasons I can't give you. And you can say yesterday, that was 12th December 2020, only 10.14434 lakhs, 10,14,434 individuals were tested only. It's too low if you want to compile this destiny, or else as usual it's going on, so there's no meaning in commenting that. And if you see how many people so far have been declared positive of COVID-19, it is 98,57,029, 98.57 lakhs. This means about, you can say, about a crore, approximately 1.1 short of that, so it's 98.57 crores. Yesterday, positive cases were recorded 30,254, while updated deaths till yesterday is 143,019, 1,43,019. This is abstract, summarized report that has been seen on government website, and that is mygovernment.in, mygov.in/COVID-19. In this report, in this reflection, I have included number of days, then date report or report day with remark, and population with all rows, so that it can be formalized adequately. Then percentage daily tests in relation to population, which is too low, and this is just yesterday it was 0.078, while average it is 0.079. And then total test update is there, which I just told you, 15 crores something. It's 15.37 crores. And here is percentage total tests done to population, which is very, very small here, as I said, 11.824, while remaining people amount to 88.176 percentages. Then this is daily tests conducted in numbers, and that is here 1014434, which is 10.14 lakhs. And then updated information on positive individuals is 98.57 lakhs, as well as you can say here, this is infection update, and daily positive is here. Then that update, like this information, we are getting feedback from official site, and this is yesterday's case was 3254, and that's 143,019 updated one, not yesterday alone. Alone yesterday was 391. This is your record, and here is average, and it gives you days, and it gives you many other informations. Ultimately, we have to say, still, if we move this speed, if I say I'm not responsible for that, government is responsible. I am just observing what they are giving. If they keep like this, now I don't know, first of all, what's the scheme of government, whether they shall test all individuals or only those who complain about some symptoms, only those shall be tested. It looks from this report that there is no scheme as such, that everybody would be tested. Otherwise, by now, why it's only 11.824% in 288 days? It should have been more than this. It should have been 30%, 40%, or 50% around. This means there is no such scheme. Government concludes that it has no responsibility. Virtually concludes that, and that is of course unfortunate. So, if this is correct, if I suppose that they are testing everybody, then it will take 1124 days for population that has not been tested. And it depends upon. Now, before going to that further conclusion and discussion, I'll like to give you statistics of yesterday, that is state-wise names of these states and COVID-19, Bharat, and status of yesterday, reported today, and this is your status of state, total cases, active cases, discharge cases, that's active ratio, discharge ratio. This is just copied from that website. I'm just referring to that one. It's nothing to do with me. I've not done anything on this. And it says Maharashtra has 18.7699 lakhs, Karnataka 9.00214 lakhs, Andhra 8.75025 lakhs, and Tamil Nadu 7.97693, Kerala 6.6463 lakhs, Delhi 6.05470 lakhs, Uttar Pradesh 5.64132 lakhs, then West Bengal 5.19215 lakhs, Odisha 3.23364 lakhs, Rajasthan 2.8 2.999 lakhs, in Telangana 2.77724 lakhs, in Chhattisgarh 2.55761 lakhs, and Haryana 2.51402 lakhs, Bihar 2.41776 lakhs, Gujarat 2.26508 lakhs, and Madhya Pradesh 2.22397 lakhs, Assam 2.14584 lakhs, Punjab 1.59579 lakhs, and Jammu Kashmir 1.15626 lakhs, Jharkhand 1.11366 lakhs, and Uttarakhand 81,939, Goa 4930, Himachal Pradesh 48,951, Pondicherry say 3,744, Tripura 3303, Manipur 7,036, Chandigarh 1,857, and Arunachal Pradesh 1,650, and Meghalaya 1274, Nagaland 1167, Ladakh 1913, and Sikkim 531, Andaman Nicobar 48, and Mizoram 403, Dadra Nagar 33, and Lakshadweep 0. This is total details given on website, so it's nothing to do. I am now projecting it. That's my work here. This production is here. As usual is 5.4, which is sum of 1.19 deaths and active cases. Now I'm just considering 1.19 case for 11 point something percentages, or nearly 12 percentages, and I counting here 130 crore population. So if we suppose, we imagine today everybody has been tested, in that case, in relevance to this 1.19% death cases, it should be 1.55% death cases, 1.55 crore deaths. This is statistics, means I'm not saying these deaths have occurred or are going to occur. I can't say that. But data speaks something. Government itself says 1.19%. That's out of those who have been infected, and some have been released while others are in active mode, whereas those who are not in active mode, means who have left this world, it's 1.19%. They have left for their heavenly abode, and this is 1.55 crore if whole population has been tested or may be tested. Then I have given input of 0.25% 0.25 coefficient for a period of, if you count now, for a period of a quarter of a year. So quarter of one can be given. So this 1.19 goes to 1.49, if you can see the formula here, this value multiplied by 1.25, so we get 1.94, and in next one also another 25 part, 2.25, 1.25, we get 2.42, whereas next quarter, this is 3.03, so followed by each quarter, we are getting some figure, you can say 3.7, followed by 4.73, followed by 5.91, followed by 7.39, and when it is 25th month, it is 9.24 crores. So if this stage continues, there is no improvement, nothing is exploited, exploration is not done, they sleep and do like that. So there could be uninformed, or you can say 9.25 crore people loosen their life possibly. I can't say, and you can see this graph itself is a representation of this data about death. So you can say this is very steep, here it's okay, but here it's very steep slope, must be careful. We have to be careful, so there can be nothing, it's just a suggestion about elaboration, what data says something. And here are 3 questions, as usual we talk every day about whole population, actions, what actions are there, this we have to clearly understand what actions are there. No actions have been suggested, what government target is, what government milestone is regarding COVID-19, and what is their schedule or bar chart or whatever way they want to depict that. It's not given. All these 3 presumptions about whole population actions and target milestones and schedules are controlled. No one has been given by government, and when I write to them, this refer here and refer there, I got acknowledged mail, but doesn't give anything to me which is of good conduct, good use, useful information. Nothing as such. We go back to our graphics here. You can see this graph as usual, just extended further, and this graph doesn't give any shoot up or shoot down. It doesn't say, so testing will go like this, testing, and it's not giving anything. So this graph is also obsolete now as far as this, obsolete in a sense of consideration. And same data, yesterday it was 11.82% and 10 lakhs over 14,000 tests, while before yesterday 10%. A little drop is there, there's little drop. You cannot consider major drop, but there's some drop here, which drop is not actually required, but it is there. How much is that? We can just calculate that one. You say this one minus this one, which is this one. I'm sorry, this is my wrong state. This one minus this one is equal to this one, and if you take this here, if I take this bracket in and divide by a lower value, this here multiplied by 100, so I get 5%. There's a 5% drop, so let's not make it too complicated, because 5% plus and minus works, but it's also giving indication that there is no thinking behind projecting these tests up. Means to raise the graph is not any consideration, doesn't seem to be any consideration there. And total cases, 98 lakhs 57,000, it was 26, so just added 30, 30 to 5 for more patients into, while 9 still remains there out of this 9, and 36 crores 43 something still remains there. There is no running away from there. Again points comes in, then what shall happen to this country? I can't answer, because report is similar as before. You can see that the government is sleeping and people are sleeping, and inefficiency occurs everywhere, and drastic failed government as far as COVID-19 is concerned. Government is not interested in testing whole population. Unfortunately, this is construction interpretation from this report. You may accept or may not accept, but the question is data itself speaking, and I can only suggest that we have to expedite this. So we have only two criteria: either it should be done in 6 months, or it should be done in 3 months. If within 3 months, you have to multiply your resources by 12 numbers, and within 6, you have to do this by 6. So there's a range of 6 to 12. You have to upgrade and you have to multiply available resources to within this range, 6 to 12. And if you do that something, what I say, nation has to stop allowing corona to make corona bomb. It can be done that way. It can be done. If you don't want the explosion, you have to raise resources to meet our requirement. And nuclear fission may be avoided, because it must be avoided. We don't expect nuclear fission of COVID-19. So I would say only that I want to see all those figures down. I want to see XY tests from, it may be 62 or 63 lakhs per day, or it may be 1.26 crore per day. It depends upon how much they can do. They have resources, but nobody is very serious. It seems they are not too serious. That's unfortunate. This is eating us. COVID-19 eating whole world. It's impacting our country as well, and shall keep us impacting if we don't take care of this. And we should take care of this, but we are not taking care of this, unfortunately. Every day I try to apprise you about this so that you keep in touch with that. Because data is available, what ministry gives, but there is no meaning of data if people don't view it, or people don't understand it for purpose of interpretation. There is no meaning of survey or data record if that's not given to public. It's given to public now. They are giving in a way just to fulfill formality, but public has to understand that in which state of COVID-19 we have been. We are in darkness or we are in light. Means I can still say we have been in darkness because we can't see light till now, that we can handle this. They are handling in whatever way they think, right or wrong, or what the world is doing. What the world is doing, what is very seriously doing tests on those people. Here there is no such, you can say, action from government. It's unfortunate. We have to be very serious about this matter. Now, it's very simple to criticize. My purpose is not to criticize anyone. That's not my aim. My objective is that since every country and our country, along with all other countries, have been encountering or handling COVID-19 impact. We are now, you can say, biggest in population size except China, because China has done it well. We have not done anything, so we can say democratic wise we are biggest population. Only country in world currently is Bharat, India. That would meet such challenge posed by COVID-19, because all those European countries and America and you can say Gulf nations and Far East, they have handled their way in their own potential. They have done well. Still, COVID is there, but we have not done well. That is really a complaint. We have to complain ourselves. We have to complain ourselves. We have to talk to ourselves. Why did we fail? It's absence of will on government, or it's absence of will in public. That is very important point we have to consider. Just saying we have done well, or death rate is this, or discharge rate is this, that's not a requirement. We don't require that information. What we require is how many people have been tested. How many people have been tested means highest percentage is requirement. If we have that, means say if there have been the 40% people have been tested or 50% people have been tested, I would be very happy, and you should also be very happy. Question is not of COVID, question how to handle it, how to keep yourself safe by this impact. That has not happened. It's shameful, it's really shameful that only again I say, it's very shameful that only 11.84% people have been tested in 9 months, more than 9 months, and 88% people don't know about their future, whether or not they shall be tested. Because I think mostly so far those who tested, they tested voluntarily, had been symptomized, or they thought, so they got tested themselves by paying money, and maybe some common people who cannot pay money, maybe testing in government centers. But it doesn't give information. 11% or 12% is very small amount in a country where there is 130 crore population. So this is only point where I catch hold of everyone. I catch hold of government as well as catch hold of people. Why we are so weak in managing, organizing public testing system. It's really tragic, it's disastrous what we have today, state of COVID-19 in our country. That's the only reason that I keep watch on this and eye on this. And I want to, recommend that testing must be done rapidly in a period of 3 to 6 months maximum, and our resources should be multiplied, should be, augmented on ground where reliability is working or works all over this country. And if that is not done, then we are sheer failure. We should not appreciate ourselves. I see some people appreciate they are doing very well. Well, I don't know where is very well on this data. I can't find very well. If you can find, tell me that this is very well. I'll be happy to know that. Whosoever you may be Bhakt or you may be non-Bhakt, you may be government or you may be minister or you may be prime minister. Whoever you are, please tell me on this data you submitted on website, which one is very encouraging, which one is very recommended or appreciative. I want to see that. Unfortunate it is, I'm not getting that information. Howsoever, I'm not getting information as such. Unfortunately, it is. I don't know why people just tell lies from ministry level. from government level and from public level. They just feel, oh, very well done we have. I don't know what well done we have. 115 crore people do not know about their COVID-19 and you are feeling happy. 36 crore people are expected to have COVID and you are feeling happy. There's expectation of 9 crore people to lose their life in coming times and you are feeling happy. This is your performance. Really, if this is your performance, no one can help you. Nobody, if you don't have will to handle something, then I cannot say that's right approach. One should not hide anything. Hiding is not a question. This is not a subject where votes can be fetched in. It's public health. Again, I'm saying it's health, safety, and environment issue. Nothing to do with politics in this. It's a question of people's survival. If people survive only, then politics can be conducted. If people don't survive, how can you conduct politics? How can you talk politics? Because many politicians have also lost their life. We have lost all over the world, many leaders have lost their life, political leaders. Many doctors have lost their life, many nurses have lost their life. So it could be the same thing. Here you have to see that tragic state, fine, it's okay, it's up to you. But it doesn't mean anything. If you want to cheat ourselves, we want to cheat yourself, it's different. Means data is good, but it's not good in a way it should be. If they give projection, we can know what plan they have. There's nothing as such. So what I can say, this is all drama, or you may say whatever you can say. This is all drama. Just you can say a formality of this data, and I just try to understand this every day. It's not very, very difficult. It's in very simple terms. If ministry can tell whole people, tell world when shall complete all tests, it shall be supportive. It shall be supportive for people, because people shall know what they are doing. It's really very, very interesting what they are doing. What they are doing or what they are doing, I don't know. After all, what are they doing? You cannot say. It's really very unfortunate that we don't have elaboration on data. It should be given by government. It's more than 290 days. They have not done that. Unfortunate it is, really unfortunate it is. I suppose ministry has intelligent people, ministry got good professionals, and they can handle this if they wish. But where there is a will, there is a way. And where there is no will, there is no way. That is life. So it seems